they did a series of postmortems and they thought they'll find the lung, completely filled with all pneumonic patches and all that. When they opened up, they found blood clots, actually blood clots in the lung, which they were not expecting. Even the what is picked up in the CT scan was actually blood clots, which you could not, like a shadow it is, you really cannot make out. They thought it's a pneumonic patch. So there was no pneumonia at all. In fact, it was these clotting, micro clotting as well as macro clotting. Some of the places, big, big clots were there. So they said, oh, this is a clotting mechanism which is taking place. So something the virus is doing, it's sparking off a inflammatory reaction, something like a danger, some signal it is sending, asking the blood to clot. And so it is clotting in all kinds of places. So it produces heart attacks by clotting and things, strokes. So many strokes came due to that. Even young people, some of them develop strokes after that. Kidney, blood circulation getting blocked, liver, all kinds of places. They found these clots. So they said, okay, now what we have to do is to give anticoagulants. So they started giving anticoagulants, which is still there. Even now, the anticoagulant therapy is one of the accepted therapies because that's how people die due to these clots. Then what they found was that in the ICU, once they discovered this, they found that something is going wrong with the immunity inside the body. The immunity is totally going haywire, and this hyper-inflammatory response. They're able to see that suddenly all kinds of inflammatory things are going on, which is uncontrolled. So you need something to suppress that. And that is how the steroids came in. So coming back to the recovery trial, so they tried that and they found that it worked. So having done that, they laid the criteria and said, use dexamethasone, use 6 milligrams, use it for 10 days, use it after the first 1 week. First 1 week, please don't use it. Use it in the second week. When you're in ICU, when you're sick, that's the only time when you should use it. If life is in danger, then you use steroids because it is life threatening. Because at that stage, you don't mind if the sugar goes up or something goes up. You really don't mind. You're struggling with the patient and saving the life. And there, steroid become not only for this, any condition, of blood pressure is dropping, you give steroids. If something else is going wrong, you give steroids. Steroid is all, it's like a sarva roga nivarani kind of a thing. Anything where your life is in danger, you give steroids. And it works. That's how it works. So that is how steroids came. But then what happened was, many countries, I think including India, people started thinking that it's a prevention for COVID or it's a palliative. Oh, COVID is life saving. So if I take COVID, I won't get COVID. If I take steroid, I won't get COVID. Nothing can be further from the truth. You're actually promoting the virus and inviting the guy and saying, come, 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 I'm clearing the road for you. Now you walk in, without any. So steroid should not be used as a prevention. It is not a prophylaxis. It should definitely not be used in the first 1 week because that's when the virus is multiplying. If at all you're in hospital, is the only time when you can use a steroid, not at home. I find a lot of people at home taking steroids in the second week. Now it's second week, now I'll take steroid. You should be in hospital, you're taking steroids, okay? If properly used, the steroids are good. As you mentioned, there are many, many side effects of steroids, one of which is your sugar will definitely go up. Even in a non-diabetic person, completely non-diabetic, inject the steroid in this dose, and within 2-3 hours, your sugar will go up. That's a natural phenomenon. I know of a former VIP whom I was treating who was not diabetic in Tamil Nadu. And I used to be frequently called because the sugar goes up. He was on steroids for some skin condition or something. And every time I look at it, the rest of the day is completely normal. But when he takes that steroid for 3 hours, it goes up. And the question was, should we give insulin for that? I said, you can't. He's an older person. You simply cannot give steroid. 3 hours later, it's coming down. Just leave it and it's coming back to normal. It's a normal physiological response of his body. So don't do anything to do that. But in the doses that these people are giving for COVID is much higher. So it won't be just for a few hours. It may be half the day, it may be high. So you might need to give insulin, and tablets will not work at that time. You have to give insulin. Insulin is like a counter to steroids. At least it's glucose levels. So you can give that and prevent that very high spiking of glucose you can prevent. But steroids also reduce your immunity to a large extent. That's why it's given. To reduce your hyperimmune response only, it is given. So steroids are a double-edged sword, as you said. Can be life-saving, can have a lot of side effects. Sugar is one of the main things. And as you mentioned, the black fungus. Now, when you have steroid, your immunity is going down. So suppose you already have a little fungus in the nose and so on. Normally, it will just die off. It's a harmless fungus, it will go off. But again, like the COVID virus, if you are inviting the fungus to grow, it will grow. It will grow. And see, I'll give you I'll tell you what this fungus is like. It's like this mold. And if you take bread, stale bread. Have you seen stale bread? You keep it out. What happens? A green kind of color comes on it, isn't it? That's the fungus. The fungus is coming because it's moist. You kept it out. Air is there. So that's the oxygen part. Okay. So air is there. So the fungus multiplies in that air. It's kept out. You keep it in the fridge, you won't get any fungus. In a controlled atmosphere, you're not exposing it to air and you're keeping it in a controlled thing. You won't get fungus if you keep it in that thing. Here, the similar situation, you're lowering the immunity, then you're giving oxygen, then you're giving a steroid to do that. Plus, you've got uncontrolled diabetes. So it's a good culture medium for this fungus to keep growing. So it hits the nose first, produces some blackish discoloration and all that. From there, it goes to the eyes. From there, the eye can get affected, get paralyzed, swollen, protruding out, red. Then from there, it can, through the sinuses here, there are veins here, straight into the brain. Then once it goes into the brain, it's almost always fatal. And even otherwise, the mortality is quite high. So this black fungus is something which comes in this situation of uncontrolled diabetes with or without steroids in an ICU kind of a setting where the fungus is, multiplying and perhaps a little bit of unhygienic conditions. They say the moisturizer which is used in the humidifier, there, if that water is not clean, you can have fungus in that. Or the tubing, that can have a little fungus. From there, it can spread. So that is what this mucormycosis or black fungus is all about.